is Maridel Santos, and I'm a medical program specialist with Alameda County Social Services. I'm not an eligibility worker. So what I'm going to do today is just present you with just a medical overview. It appears that some of the speakers have already may addressed the issues in regards to defining what Medi-Cal is all about, what affordable healthcare is all about, what the Obama healthcare is all about, Medicare in terms of the payment, what Medicare pays, what it doesn't pay. We have legal aid here who also assists with the appeals issues or hearing rights that you may have also. And those hearing rights are also available on the back of your notices of action when you apply for medical programs. Okay. Let's see. So I may go through just briefly or just skip the different sections that may already have been addressed. Additionally, if nothing else, I do have some good resource numbers that you can contact in regards to if you have any type of billing issues or questions as to whether a procedure may be paid or not under the Medi-Cal program. Alameda County Social Services, when you deal with our agency, we don't deal with billing issues. We do deal only with the Medi-Cal aspect of eligibility. Okay? So when you do speak to a worker and you try to ask them questions about billing issues, they are not in a position to answer those questions because they're not familiar with the billing codes or any billing eligibility aspect. So they're okay. So let me go through. Again, this is what Medi-Cal is all about. It's a free or low-cost coverage for California residents. As mentioned before, in 2010, the federal government enacted the Patient Protection Affordable Health Care, also known as Health Care Reform or Obamacare. We work closely in conjunction with Covered California, which is the healthcare exchange. The counties assist with persons' eligibility for Medi-Cal and any subsidies. What is Medi-Cal? The Medi-Cal expansion. Let's see. So California approved the Medicaid expansion, which is Medi-Cal in California for childless, non-disabled adults between the ages of 19 to 64 years old. There was a time when, in order to qualify for the Medi-Cal program, you had to be age blind or disabled or be over 65. Now, because of the expansion of the Medicaid program, as long as your income is below 138% FPL, which is the federal poverty level, you qualify for zero share of cost Medi-Cal. I've also attached a chart at the back of your the handout that you have. So if you need to know more about what is the 138% FPL, let's see. It also applies to the to former foster care youth up to age 26 from any state. Now, a lot of you may have heard the word MAGI and are trying to figure out what is MAGI. So MAGI is the definition for modified adjusted gross income. Oh, okay, and it's a way of doing budgeting in the Medi-Cal program. It's not a new Medi-Cal program, and there's no asset test under the MAGI determination. It's all based on income. Again, the 138% income. Let's see. Okay, so the asset test is eliminated. So under that program, it doesn't matter what you have anymore. It's what your income. It's all based on income. And let's see. And again, these are the criteria, the eligible population, 19 to 64, children under 19, and pregnant women. So these are the household composition. Usually when you apply for Medi-Cal under the MAGI household composition, there's three categories that we look at. We look at the tax filer, if you're not claimed as a tax dependent, tax dependents, and non-tax filers. In California, you need to be able to provide proof of residency, and the citizenship or the recent legal immigrants is usually immigration status is usually verified through the federal data hub. Now this is non-MAGI Medi-Cal. When we refer to non-MAGI Medi-Cal, we're referring to if you're age 65 and older. It's a different criteria for determining eligibility under this program. So this program is for the aged, blind, and disabled, and for residents of a long-term care facility. In terms of, let's see, under this program, there is an asset test in terms of, unlike the MAGI program, asset test is eliminated, but with this there is a limit. So for just an example, for regular medical, for a family budget of 1, your resources cannot exceed 2,000. For a family budget of 2, it cannot exceed 3,000, and any additional, 150 for each additional member. Okay. Personal property referred to as cash, bank accounts, credit unions, stocks, bonds, cash surrender, life insurance policy, 401k. And in terms of the life insurance policies, if the policy is not in your name, but you are the beneficiary, and someone else is the owner of that policy, you don't have to disclose that to our agency because that's irrelevant. It's only if the policy is also in your name as well as you're the owner. Your primary resident is exempt regardless of the value, as well as your vehicle. If you do have other properties, it's exempt only if the value is $6,000 or less, and the net income received from it is 6% or more from the net market value. Again, for this, if the eligibility worker will be the one to make that determination because they have a separate form that needs to be completed to make that assessment. So that's a discussion you would have with your worker. These are, in terms of income, I've listed, we refer to as wages. For self-employment, aid in kind, unearned income, we've listed Social Security benefits, unemployment, state disability, veteran benefits, child support, alimony, retirement, pension income, aid in kind. Share of costs. This is just a typical example of how a share of costs is calculated. For example, if your gross income is $1,100 and you're working, we allow a $90 deduction. It's a standard deduction. So your non-exempt income now becomes $1,010. Okay? The maintenance need for one person is only $600 at this time. It has not changed in several years. So then your share of costs will be $410. Okay? But your $410 is a monthly share of costs. However, it's not something that you have to pay. It's not a monthly premium. As noted, when there is a share of cost, the medical beneficiary has to pay out-of-pocket expenses to meet the share of cost before Medi-Cal pays. The share of cost is to be met in the month in which services are provided. It is not a monthly premium. So as an example, if your bill is $300, for example, and your share of cost is $410, you do not pay that $410 because your bill is only $300. Okay? And just a note, if you have any unpaid medical bills, you can also use that to decrease your current or future share of costs, and which is referred to as Hunt versus Kaiser. These are just additional deductions that's listed also in your handout that we allow for the aged, blind, or disabled. $20 any income deduction, $65.50 of earned income, and health insurance premiums. On the special programs, just a little background. It's limited to coverage to life-sustaining medical treatment. Of course, you're required to pay a percentage of the treatment as indicated earlier. And it's limited to individuals in need of kidney dialysis or parental hyperelimination treatment, also known as TPN. It also targets our children program, the QIMBY program, Qualified Medicare Beneficiary, which pays for your Medicare premium. Oftentimes, if you are you have Medicare Part A, and you're seeking for assistance to pay for your Part B premium, you would apply through our agency to see whether you qualify for the Part B. And if you don't qualify for Part B through that way, we have the SLIM-B program, which is the Specified Low Income Beneficiary. So just because you're on SSI, you still should apply through our agency for the QIMBY program, the Qualified Medicare Beneficiary Program, to see if you qualify for us to be able to assist you to pay that premium. Okay. We have also the Qualified Working Disabled Individual Program, and we have the 250% Working Disabled Program. Again, these are also, again, other, the TPN programs that we have, the tuberculosis program. For the special medical programs under dialysis or TPN, as stated earlier, you have to be able to meet all this criteria to be eligible for the program. Again, these are also supplement. Under the eligibility requirement, the first 40,000 of the fair market value of applicants or beneficiaries' home is usually exempt. So there are certain criteria also to qualify for through the Medi-Cal program. And for the Medicare application, you must apply for Medicare within 10 days of applying for one of the special programs that we offer through our agency. Resources, you can apply for the Medi-Cal program via Covered California, by mail, or through social services, mybenefitscalwin.org. Okay. You can go in person or by mail at Alameda County Social Services. And I've also noted the 800 number for Covered California. And these are the different offices that's available. We have the Eastmont Sufficiency Center, the Livermore office, Eden, the Hayward office, the North Oakland office, the Enterprise office, and the Fremont office. And they are now also open between the hours of 12 and 1. Okay, so it's open from 8:30 to 5 o'clock. And this is a very important number that I think that you all should make sure that you have this handy. This is the billing department in Sacramento when you call this number. It's 916-636-1980. What this number does is if you, say you were to receive a rejection or from a provider saying that it's not your prescription that you're seeking or the service that you're seeking is not being paid under the Medi-Cal program, you would need to call this number and they will explain to you why, or if even the procedure code that's being used is the correct one. Make sure that when you do call that you provide the national drug code or procedure code obtained from your pharmacy or the provider. Okay, so this is one of the very good numbers to make sure you have handy, because oftentimes we receive calls stating that it's not being paid for your bill. Healthcare option is another number to have handy. When you're approved for the Medi-Cal program, you're usually given an option to select a healthcare plan. On the, whether it be Alameda Alliance, Blue Cross Blue Shield, that's a number you would have to call to make that plan selection. It's not done through our agency. Okay, let me just go back. This is the federal poverty level chart that I was referring to. It's also in your handout. I know it's small. Sorry, but it's in your handout, and you can't read it there. Okay. If you need a bigger version, I can also provide that to you. Okay. And this is the explanation of the different categories. All right. Where do you find adjusted gross income? When you're doing the MAGI determination, it's on line 4 on Form 1040 Easy, 1040A, line 21, and Form 1040, line 37. And again, these are just common terms that we use: federal poverty level, legal permanent resident, modified adjusted gross income. The exchange, what it is at CalHERS, retention center, certified enrollment entities, and counselors. And that's it.
All right.
Okay.
Thank you.